Yeah.
So, but it's the rating against the education.
Permission. I know you're not on this committee, but you're more than welcome to join us here.
I don't think Glenn's gonna be here. You can come sit next to me.
Yeah. Let's come sit next to him. We got drinks and snacks up here, brother.
I know. I'm perfect. This way I can slip out.
Oh, we won't notice.
We'll
We won't
notice.
notice. We won't notice.
How you think we're gonna not notice?
Spoke of invisibility. Welcome to Hogwarts.
Oh, my goodness. I'm still waiting for my letter.
Get under the sorting hat. We're going to call our meeting to order. Hello, everyone. We're happy to have you here. It is 5:09. And the Program Services Committee of the Children's Services Council of Leon County is called to order. Welcome to our main meeting. And as a reminder to our in-person audience, please complete a comment card and provide it to Ms. Jacinta Clay to address the committee today. Opportunities for public comment are noted on the agenda and will be announced for each applicable agenda item. Ms. Clay, would you call the roll?
Mr. Bryant,
Here.
Dr. Glenn, Mr. Jones,
Here, yes.
you have a form.
Thank you. I didn't get my PhD this meeting. No problem. Is there a motion to second or approve the agenda as presented?
I'll move the agenda.
And I'll second it. It is thereby approved unanimously. Any public comment?
Yes, we have general public comment from Mr. Neil Skin.
All right. Hello, sir.
I lost you. I couldn't find you. Thank you, Mr. Chairman, and members of the committee. Mimi Graham's name on your list reminded me of a piece I put together, a lot of help from her about 10 years ago. And it's about investing in kids. So I pulled it out, I lightly edited it, I handed it out to the Finance and Budget Committee the other day. And so she has no responsibility for what I wrote, but she was a huge help in writing it. So I wanted to pass that around to you. And it's something I want to talk about briefly tonight. The twin pillars of business success are adequate capital investment and product quality. And I was reflecting tomorrow morning, my son and I, he is a tech engineer. We're getting on the plane to fly to Warren Buffett's shareholder meeting in Omaha. And I looked back in November of 2020 when voters approved this council. Berkshire stock was at $215 a share. Today it's at $330 a share. That's about a 50% investment. If you had given me $1,000 to invest in Warren Buffett's company in 2020, and I'd invested only 75% of it, you'd be mad at me today because the return on investment is very high. Investing in children is very much the same. You can see economic development dollars. You can see it in Cascades Park is built. You see the condos and the hotel that goes around it. I learned this week that the new cross-country course that's been built on Brownfield's property is going to host the World Cross-Country Championship in 2026, I believe. But there's also a significant return for children. You can't always see it. You can't always see each individual success, although you can see a lot of them. And so in this paper, you can see the comments of the Joint Chiefs of Staff, of the U.S. Chamber of Commerce, of former chairman of the Federal Reserve, observing that our nation and our economy is stronger when you invest in children. But I also want to talk about something I didn't talk about the other day, which is the importance of product quality. Some people think performance standards of this council are not high enough in the programs that are being funded. The question is not how many kids you serve, but how effectively you serve them, and that assessment of the cost effectiveness of those programs. It requires a lot of work up front. It's one reason additional staff it requires effective engagement with providers. So I'd like you to use your full tax authority this year when that discussion comes around, but I also want you to this committee is responsible for the care and quality of the programs that they serve. So keep your standards high, keep some powder dry, and invest in our kids. Thank you very much.
Thank you, sir. Are there any other speakers?
We have a written public comment from Ms. Stephanie Noller, and you all should have a copy.
Thank you. All right, we'll now move on to high quality early learning services.
Yes, thank you so much, Chair. I just wanted to provide some quick updates. So on Early Learning Coalition on-ramp program, that contract has been executed with the Early Learning Coalition of the Big Bend. I do have to take a moment to recognize a board member who's not only on our council, but is on the Early Learning Council, and that's our council member, Paul Mitchell. He's gonna be upset because I did that, but I think it's, I know that he is exceptionally proud of this partnership. The thing that I also want to note is that, as you know, our Early Learning Coalition serves 7 counties. We were partnering with them to put $250,000 in to help those families that are just over the income level get into school readiness. They estimated we would serve about 505 children and pull down about $2.8 million in money. Well, when they went to the state to make sure they had it set up correctly, the state said, well, since you have a private investor, we will invest dollar for dollar to allow you to serve the other 6 counties. So they will be able to double that to 1,000 children, 500 in Leon County and 500 in the surrounding counties. So that $250,000 is going to pull down literally almost $6 million. So we are really excited about that, writing the contract such that if it works the way we know it will, we'll be able to expand that and do good things. So wanted to report out on that.
Congratulations.
Yes.
Are we reporting that out?
We're trying to get an actual precedent. We are already getting calls. We are getting social media asks. So there are people waiting in the wings.
All right.
Yes.
You'll
So
let us know when that occurs and who might participate,
absolutely.
perhaps both boards.
Yes, absolutely. ELC is taking the lead. We're looking at right now, May 23rd. But when I get that firmed up, I will send that out. We've had to change it a couple times for the first time.
That's graduation. That's fine. All right, thank you.
Okay, the second thing is rebound and recovery and resilience. So you guys were present when the representatives from Florida State came over to talk about rebound and recovery. You had great questions. They are working on tweaking that proposal. In the meantime, the First Lady Casey DeSantis, has announced a resiliency program that will be infused into the public schools. We are trying to get specifics on that because we want to ensure that we're not duplicating. Originally, we were talking about doing 4 schools, pre-K through 2nd grade. If this resiliency project is going to be focusing on that, then we may look at pulling it out and going into preschools. And it is already being piloted in that area. So more to come on that. And then lastly, part of the conversation that you'll have today will inform the high quality early learning strategic framework at some point. And the reason I say that is because I just got word today that when looking at the budget, it's in the cooling off period. Early learning across all categories is getting almost $1.6 billion. And in those early learning services, it's about 315 million. So we want to be very thoughtful as we invest in that space to, first of all, ensure that all of that ARPA money has to be encumbered, that 315 has to be encumbered by the end of September this year and has to be expended by the end of September next year. And it goes across the board. So I think we can hold off on that strategy until we know exactly how that's going to work. With that, we will be working very closely with the Early Learning Coalition to ensure that we are just not duplicating, but rather complementing. So that was all I wanted to provide on high quality early.
Oh, that's very good. On rebound, recovery, and resiliency, do we have a process by which we make determinations regarding non-competitive solicitations or proposals?
We don't have a formal process, but we do allow for, I want to say it's similar to sole source. So if there is truly no other way or no other avenue that a program is offered, then they can approach this committee first and then take it to the council. We were looking at rebound and recovery specifically as an innovative program because it is not evidence-based yet, and they are continuing to build out research.
Right, and I understood that, and I thought their presentation was worthwhile, although I thought that to do it with, I don't want to just talk about it, I want to talk about our process more than anything. I think that perhaps either through the executive committee, the other standing committees are executive, finance. I think there ought to be a method by which we manage non-competitive solicitations that come to us, that they're not arbitrary, that we might set certain parameters perhaps outside of what are our already existing RFP cycles or RFP designations, right? Our 7 areas of concern. Because I think it provides, without a process that is identifiable, then how do we make the determination of who we would consider sans any process that articulates where we would want to accept those types of proposals and subsequently award those types of money outside of an already existing RFP process?
So we can work with our general counsel and start with a draft. And then
It can come out of this committee.
yes, I think it would come out of this committee because we're talking about programming.
All right, well, that's fine.
And we can bring that to
Do
the committee.
you see where I'm coming from?
Yeah.
Okay, all right. All right, well, since there's consensus from the two of us, I wouldn't want you to do it because I said so. But if you agree,
Basically define the process to bring.
non-competitive solicitation to us, for us to consider. All right, thank you.
We got it.
How is that done now?
So we literally get emails, sometimes phone calls, and then we look at what they're offering in line with the categories that are your priorities. And then of course, our larger priorities. We also look to determine whether it could be competitive. For example, if a program comes and we say, oh yeah, we know 3 or 4 companies that are doing that. So, or 3 or 4 organizations that are doing that or a version of it, then it wouldn't be something we would want to bring and let them present to you, but rather let's determine if it fits into a competitive piece. But if we're, I don't know any other way to say this, but to say it, if we're bringing it to you, we have vetted it to
Well, I
say,
think that's what
this
you're-
kind of fits in line with where you are.
I'm assuming that's what you're trying to get to.
Right.
Is there a vetting process?
Right, and what
Before
is
things
that?
get thrown.
Right.
at the
Yes.
Committee and at the.
Mhm.
And I'd like to know I think we ought to codify what that process is,
Absolutely.
such that it's not arbitrary. And I think the board should have some influence in terms of what cuts mustard
Mhm.
for us to consider outside of our already existing RFP process. All
So we'll
right,
bring it back to this committee.
all right, thank you.
Okay.
We now have a discussion on prenatal, postnatal support. We are going to devote 10 minutes, about 15 minutes to this, all right? We've got 3 presenters, all right? We'll first start with Dr. Mimi Graham. Hello, ma'am.
Hello,
Good to see you.
thank you.
Happy to have you. We look forward to hearing your presentation. Thanks so much.
Do you mean 10 minutes for all of us?
No, we'll do 15 minutes. Y'all have 5 minutes apiece.
Okay,
How does that sound?
we'll see.
All right.
So I followed your questions that you asked us, and so there's an overview of what we do at the FSU Center. Mimi Ritchie is also at the center, and we've both spent our lives working in prenatal, that area we call the first 1,000 days, which is from conception to age 3. And so we've also worked with a lot of CSCs across the state, and Palm Beach, for example, has the best maternal child health care system probably in the country. People come all over to see what they've done. And so I went back to the statute to look at it, and what it says is that we look at the needs and we look at the highest need kids and families, and then we have evidence-based services that match those needs. And so when I looked, on the latest Florida charts and was looking at what are our highest needs, and I imagine Healthy Start agrees with, because it's the same data. But when we look at, almost 40% of our moms deliver on Medicaid. So we've got a lot of families with needs before they ever, deliver the baby. When I was surprised at the obesity, more than half of the births in Leon County are to women who are either obese or are overweight. And then that leads to all kinds of birth complications. The health department, I've talked to Sandra King, the Bond health department, and she says diabetes is just on the rise and a huge problem. Women that 35% have a baby within 18 months, and we know that's not healthy. So you can look at the data here of the things that really jump out. Our maternal mortality rate is off the charts, even though it's only 5 moms that have died. Our rate is, just.
Do we still need the state per capita?
Pardon?
Do we still need the state per capita?
I believe that's. what
I'm
Dr.
not sure. I think Heather
We
Flynn had
had-
told us that we have.
We had at one
you know,
time led the state per capita in infant mortality of African American women. And it was an issue concerning.
I'm talking about maternal mortality,
Oh.
but infant mortality and low birth weight. So I was here when we started the original Healthy Start, that we have not really moved the dime on low birth weight, infant mortality, and the racial disparities. We also work in Gadsden County, which also our whole community has really high racial disparities, and we've not really, moved the dime. And part of that, Palm Beach is one of the few places that has moved the dime on racial disparities. And what they did was they went into the Census Bureau where, there were the problems, and they put in an evidence-based program like the Nurse Family Partnership. They evaluated it, either works or it doesn't work. You continue it, or you find something else. And so, so being very targeted about where the need is, not just, throwing it out. I also, when I talked to the Bond folks, they talked, and Heather Flynn too, that perinatal mental illness is one of the biggest complications, and it's one of our biggest needs. At the Bond community, Sandra said that you can't get an appointment till July. And she has 2 moms with stillbirths, and there are no grieving services. She called Lee's Place. There's a waiting list there. There's a waiting list with hospice. And so, these moms who have a stillborn baby, they need help right away, not in July. And she said the number of mental health issues that are coming into the Bond community are just.
Have they reached out to Appalachia for chance?
I don't know, and she was going to be here tonight, but she got an assignment right at the end of the day, so she's not here. But I would suggest we talk with her and talk with other people in the communities about.
The reason I ask that is because we're working with them at TMH and when they have resources, and they're drawing down a fair amount of new resources this year in the state, since there's a pretty fair level of attention to mental health. But in addition to that, we're developing a new residency program. We're in the early process.
Yes.
We're doing a psychiatry residency program, which will necessitate faculty being recruited to the community.
That's
support
awesome.
Education, which will be another line of resources. So.
But right now, they only have one.
I don't know if they've contacted, Appalachia's should be a good resource for them for mental health support.
I think it's just not readily available. I mean, we work with teen moms and teen dads. One of the dads was suicidal and we haven't been able to get him an appointment. And so the mental health needs, they have one counselor at Bond. The other thing is that the WIC clinic closed on the south side of town. So now there's just the WIC clinic on Old Bainbridge. And so we work with teen moms and we take them, there's a 2-week, wait. So you finally get a girl who's had a baby, who's willing to, go for a long-acting birth control. You finally get her, agreeing to go, and you got to wait for 2 weeks. By then, she's already changed her mind. People have told her she'll gain weight and blah, 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 and it just doesn't happen. So, so I think we really need to look back at the data. The data was done now a couple of years ago, and to see, what's going on. So when Mary and I look just on the chart on page 4, so substance use. So our teens that have drug problems that are pregnant, there's a waiting list at this village. So we cannot, and somebody called me today, they have a trafficked teen who has agreed to do rehab, and there's no place that will take her. There's a place out of town and they don't take Medicaid. And so, it's not just enough to look and say, okay, what are the services? It's all the conditions about. So there's the quality aspect, and there's the availability, and then there's the affordability. Transportation. So now, these teenagers, they don't drive. Their bus system has a lot to be desired. So, getting to and from when there's just one WIC clinic. The nutrition is a problem. I said about the obesity, the food insecurity of kids under 18. So we have some suggested solutions and have tied these and have the research behind them. So I'm happy to share that. The prenatal care, again, we know there's huge racial disparities, and preconception, ideally, you work with women of childbearing age, and I know we've had interconceptual work groups for a long time. My time up?
Oh,
I better talk fast. Anyway, so there's a bunch that we need to do in addressing hypertension and addressing weight and addressing nutrition and all that before women ever get pregnant. And so many of our births are unintended, and so we need to be more intentional about that as well.
Are the concerns that you are describing, are they dealt with through the continuum of care?
Not adequately. Who's continuum of care? Our community's continuum of care? Our community has a patchwork of services. I would not call our community a continuum of care.
I thought that all the agencies were organized in the continuum of care to manage case management of families who are dealing with the types of issues that you're talking about.
I know Healthy Start does an admirable job, and yet the 5 issues that have come across my desk in the past day, fall out of the purview of that.
About Whole Child Leon, I thought they were also organized.
Whole Child Leon does a great job of bringing people together and talking about the issues. They don't provide actual services except the behavioral health program that I know of. The other thing,
I thought the one thing that they were supposed to be doing is quarterbacking more or less the activity of the different groups providing services. So even though there are these disparate activities, these groups that are all providing a piece of it, truth matters, are all running in their own lanes, and no one's trying to bring them all together for the benefit of a single beneficiary, a child or a mother. And I thought that was Whole Child Leon's role, is to serve as a quarterback or coordinator of care.
I thought continuum.
I don't think
line them up.
no, Whole Child, ask Courtney Adkins, but that's not been our experience over time, is that they do a lot of bringing people together, but they're not in coordinating the services or the service providers. nobody has that function that I know of.
Every community action agency doesn't do it either. See, I was
They do
under the impression, so I'm, okay, you don't mind, I mean.
Sure.
I was under the impression that everyone was organized as a part of what they call the continuum care. That included all the different human service agencies that provided services to families, and that no matter what way you came into to the system, there was some type of case management system that followed you wherever that kind of organized you to be for you to be served.
There is no general
So,
case
okay.
management system that, do you know?
No, so I was going to interject, so we do not have that. That is something that city, county, us, United Way, and I'm missing a few, have been working with 211 so that we can develop a true coordinated continuum of care, very similar to that is in place in San Diego. But we don't have a true entrance and you get wherever you need to get. We don't have that.
So one of the things that's helpful, that other people have done, are the doulas, and particularly for women of color, to have women of color that are helping them. And there is some data that shows if you have a Black doctor and a Black case manager, that your birth outcomes are better than if you have a white one. And so there are lots of racial disparities. We hear of, I guess people call me with all the things that are going wrong, so anyway, so doulas can provide that extra help and hand holding, and there's a lot of good data, and Mary found a great article that really has the data. So that could be a way that the doulas can help with the breastfeeding rates. We have lower breastfeeding rates than the rest of the state, and that's also a real problem at the hospital. There's one lactation consultant. I heard that there was a birth last week and she had a C-section and she waited for 48 hours for the lactation consultant. By then, she'd already, had to supplement the baby. And if you're born on the weekend, the lactation person isn't on the weekend. So one of the things Myrni does is teach breastfeeding. It's a whole certification. And other places have used this baby cafe where you have it on Monday. So, they were born over the weekend, that moms have a place to come that they can get. Because as you know, if you don't start breastfeeding right away, that boat has sailed, and, it's really hard to do it later. And then the mental health is really an issue. Depression in moms, and now we know that dads, 1 in 10 dads has postpartum depression. They got to get in the picture too, right? 1 in 5 moms. So as I said before, at Bond, the mental health appointments are booked through July. So, and then if we look at postnatal, the substance abuse wait list, the biggest number of kids coming into child welfare are for substance use, and the greatest age is around the first birthday. And we have waiting lists at Mothers in Sobriety and the other programs that we have. Again, we talked about nutrition, postpartum doulas, the breastfeeding. Breastfeeding is one of the best gifts we can give our kids. It makes them smarter and healthier and all that. At diaper bank, Miami does a diaper bank. We don't have such a thing here.
Anyway, are you at your recommendation?
Almost. Developmental screenings, that's the other thing that our screening rate, only 20% of kids get developmental screening in our community. And that's despite we have mandates from baby visits, from child welfare, and from school readiness. And still we're missing 80% of the kids. And then let's say you find a kid who has a problem, then you refer them to early steps. We refer to kids in October that still are not having services now. The 0 to 3 time is a window of opportunity. If you miss that, it's a lot harder. So the barriers to service. So Chris can talk about Healthy Start, but when they did their assessment of unmet needs, and on page 8, they found the highest ranked needs for housing, employment, food security, affordable childcare. And the issues that negatively affect pregnant women were systemic racism, lack of resources, lack of healthcare coverage, and lack of education. So when we talk about home visiting, I've been running home visiting programs for 30 years. It's a very effective evidence-based intervention that helps a whole lot of things, from breastfeeding to teen pregnancy to child development to all kinds of things. And so I would recommend that we do an inventory, and I think maybe Chris is going to talk to this, of how many home visiting programs that we have. So there's almost 3,000 births. Half of them, 40%, are to women in Medicaid or have other kind of risks. So we should just do an analysis. Okay, so how many women need the services? How many slots do we have? And then there's all kinds of home visiting programs. Some are evidence-based, some prevent child abuse, some are Healthy Start, some are developmental. I mean, and then some do all those things. Some have nurses, some have social workers, some have paraprofessionals. So in Gadsden County, we have all the home visiting programs come together and triage. Okay, there's a mom, the first time mom, well, maybe she needs the nurse or whatever. But when I talked to Healthy Families at Brehan this week, they said they have 128 slots and they can't fill those slots, that there are not enough people that want the slots. So we don't want to create something, expand something that then, and so I want to know why, what's going on with that. So that would be my recommendation. The mobile family health units, I know other places have used those. When I've talked to women in the bond community, they are not excited about that. They say that, you have trust your doctor and they don't want somebody coming on a van that they don't know that's in their business. And so that was, so I would think we would want to talk to, I would think bond clinic that already has the trust of the community or the health department, figure out how we could supplement what they have as opposed to creating something new.
They do have mobile health. Yeah, they do.
Oh, the health department?
No,
Oh,
bond specific.
Okay.
Yeah, so they already have mobile.
Then why would we want to duplicate that? That's the recommendation from the council.
Well, it was
It's
a
a
transfer.
transfer.
Yeah, it was just a part of the framework, but it would be specific for prenatal, postnatal. So not just regular, but be targeted to ensure that they're getting to those appointments and getting that. So it may be an expansion of what Bond is already doing. It was not meant to be something standalone. So it's just, yeah.
But I think all these things, we need to figure out what's in the community, what's working, what do we really need, and how can we supplement what's there instead of just creating something new. And then the developmental screenings is something we care a whole lot about, because early intervention, you don't get that time back. You can do the same thing at age 10 and not get nearly the same impact as age 2. And so we met with the Surgeon General's office last week to talk about developmental screening because we're doing a bad job in the whole state. We love the help of the hospital. It's like, before they leave, we think we need OBs to say, okay, that's the time you can think about, okay, when's your kid going to learn to talk and walk? And here's the milestones. And so they're looking at those milestones every month. And then if there's not a check off, that they are referred for service. But then we don't really have the services once we find the kids that have a developmental delay. And so we don't have enough speech therapists so I don't know what we do to attract those kind of people, early interventionists. So I guess in summary, I'd like to say that, that we need to look at the needs assessment and then look at what services are going to be evidence-based to meet those needs. And so what I would like is that we have good outcomes. That's going to be the real, test of whether it worked or not. Thank you for the opportunity.
Next.
Hi, I'm Chris Sorchik. I'm the Executive Director at Capital Area Healthy Start Coalition. We serve Leon and Collier County. In terms of Leon County, and I had my talking points, but I'm gonna just follow what Mimi was talking about. I did give you all a folder with our current service delivery plan. We have a 5-year service delivery plan. Our key priority areas that affect our prenatal and postpartum families are access to care, racial disparities in health outcomes, and maternal mental health and substance exposed newborns. Last year, we surveyed the prenatal care providers and asked them why they believe moms were not attending prenatal and postpartum appointments. The number one identified need was transportation. And then from the provider's perspective, that they believe women do not feel that prenatal and postpartum appointments are necessary. They don't value the appointments. So we took that in.
The providers don't believe that?
The providers believe that. So we, this year.
They believe that they're not.
From the provider's perspective, women do not believe it's important.
Oh, okay. I was gonna say. I think providers don't.
No.
The providers and the mothers.
Correct. From the provider's perspective, the women believe it's not important.
Okay.
Childcare was another concern. We took the providers' answers and surveyed the women this year. We had 47 responses. Most of the women responded, yes, prenatal and postpartum appointments are important. There was one mom that said no to postpartum care being important. The top reasons for not attending: transportation, childcare, insurance. So we'll take the results of that survey and we are getting ready to create our action steps for next year. Our 5-year service delivery plan has 5-year goals and objectives. Each year we're changing our action steps. We have since 2021 expanded programming for families in Leon and Wakulla County. In Leon County, we have our Sister Friends Tallahassee Birthing Project, which is targeting women of color. It is taking community members and training them to walk alongside African-American women through their pregnancy and through baby's first life, to try to make sure that they are learning to advocate for themselves. They're keeping on top of their prenatal appointments, postpartum appointments, etc. My sister friends are calling the moms before their prenatal appointment and saying, okay, what questions do you have? Do you have transportation to your appointment? What barriers do you have? Let's address those. Let's get you to your appointment. And then after the appointment, calling mom back and following up with mom and saying, okay, what did the doctor say? Do you understand everything that was said? If not, let's go through that and let's call the doctor together and let's figure this out. So they're working, it's a community walking alongside community. It's a very effective model. The birthing project has been around for 30+ years. It started out in California. So that is one thing that we did. We also expanded for parents as teachers to address the high risk needs of our community. That program's only funded for 50 people. We are just now starting to enroll. We have expanded programming to include fathers. Fathers are important, and father involvement. There's all sorts of statistics about father's involvement and how that impacts pregnancy, birth outcomes, and through the child's life. So our Team Dad program has started enrolling. We started enrolling in April. We have 20 dads enrolled with another 20 ready to be enrolled. So that has had great success. Let's see, community doulas. Mimi spoke about doulas. We trained back in February 15 community doulas. And that once again is going into the community and identifying women who want to do this work and training them on scholarship, so there's no cost to them. We are currently working on getting them their general liability insurance, etc. Once again, no cost to them, not any barriers. They will be contracted with Healthy Start as families come into our coordinated intake and referral, which I'll talk about that in a second. They will be offered doula services. And if they want doula services, we'll match them to a doula.
So explain to me just so for personal education. I know the term doula, but when does a doula actually engage with the expecting mother?
It would be around 25 to 28
Okay.
weeks gestation. So it's not that early pregnancy stage, but it is working with her about five prenatal visits, preparing her for the birth, writing that birth plan, there to support during the birth, and then 2 to 3 postpartum visits to make sure, follow up, are you going to that postpartum appointment? Our FEMUR data tells us our women aren't going back to those postpartum appointments. They're just not. They're late entry into prenatal care. That data is in your folder. We do have, oh, sorry.
The doula, mothers who opt for the doula rather than, are the doula services provided at the hospital setting or in other settings?
It could be both, but the doula is a birth support.
It's not.
Not
Not-
They're not in-
No, I thought it was a midwife. I thought it was
No,
another-
In addition to.
They're almost like an investigator.
Oh, I'm sorry.
An advocator for mom. Sometimes mom doesn't have a voice during delivery, so.
I've seen the phrase used more frequently in the last 5 years than I had ever heard it before. And I thought that was, but I appreciate your education. Thank you.
Indian River Healthy Start Coalition started the Grow Doula model 6 years ago. There is a handout in your folder. They, since 2017, served, I think, 227 families and had a return on investment of over $2 million. They have lowered their preterm birth weight. They've lowered the cesarean, the C-section rates. They have lowered or changed the disparity gap in their birth outcomes. So it's a very effective model, and I'm excited that we're bringing it here. We need it. Coordinated intake and referral, CINR. It is the avenue into home visiting programs. Mimi was talking about Gaston County, how all the home visiting programs come together. It's the same throughout Florida. Leon County, we have a home visiting advisory, our CINR team. And families come into CINR through a prenatal risk screen, which now 80% of our women are being screened correctly, through an infant risk screen and a referral from the hospital, through community referral or through self-referral. What we have found is that the prenatal care providers were not doing that work. So we changed the model and how we're doing things. And we have a Healthy Start employee going into the OB providers on a weekly basis, making sure those prenatal risk screens are done. If they're not done correctly, getting them corrected on the spot. The infant risk screen, the hospitals are pretty much 100% risk doing those risk screens. Where we were losing our families is the referrals coming over into the program. On March 16th, we actually launched what is called the Connect Family Partner Program. And that placed a Connect worker directly at TMH. The week before placing that staff, we had 5 intakes come in. So 5 infants came over from all of the hospitals. In the 5 weeks, not including this week that we've been at TMH, we have done almost 283 intakes and touched families and provided resources. So everything, social determinants of health are being addressed. Okay, housing, WIC, transportation, Medicaid, etc. So we have a great partnership with TMH. It's amazing. We're at a 90% intake rate right now versus families who are giving birth there. In July, we should be expanding into HCA. So what I'm seeing through that is now we're connecting with the families who've had infants, but the number of families who actually accept the home visiting program, to Phoebe's point, families aren't going into home visiting programs. They're just not. And so there's some kind of a stigma that we need to address, and we need to normalize home visiting programs. So that's where the effort needs to be right now. It's not necessarily increasing the number of home visiting programs we have in our county. Maternal mental health is an issue. We are fortunate that we have identified, and I'm going to get with Sandra, a licensed mental health counselor here in Leon County who specializes in perinatal and depression. And if a family comes into coordinated in-home referral right now, I have funds, not a lot, but I have funds to go ahead and connect them with her, and there's no wait list. So I can get her connected.
Is it resource the issue, or is it human resources the issue when it relates to providing mental health services? I was under the impression that there was a paucity of professionals who were available to meet the need. We're dealing with the same thing in the school system. We want to fill mental health positions, but there is not enough persons going into the field and who are subsequently being awarded degrees to meet the demand for a mental health professional. And I can imagine with the specificity of what you described, that's an even greater challenge, isn't it?
It is a greater challenge. She has 6 people identified on her team that we can connect moms with. So it's a huge issue. And then the community obviously doesn't know about her. So that's another issue, right? So making sure that Bond, that Ms. King has her contact information so she can get those 2 moms over into services through the Connect Family Partner at TMH as well. If a mom experiences a loss of a pregnancy or a birth, my worker can connect with that counselor before mom ever leaves the hospital and make sure that mom has an appointment for mental health services prior to discharge. So she's not waiting weeks for an appointment. Mimi also talked about substance exposed newborns. There is CDAC is a program that is currently out the Pensacola area. They are expanding into Circuit 2, and they will have navigators specific for women who are substance using. In February of this last year, we launched through the Community Partnership Alliance and our service delivery plan, the first meeting of Substance Exposed Newborn Task Force for our area to try to bring together those community members. And that's what the Alliance is. And that's what we are charged to do, is bring together the community to address the issues of access to care, racial disparities, maternal mental health. The problem is you send out that invite to the community and you have the same maybe 15, 20 organizations who are willing to come to the table. And so that's the challenge, is how do you rally the rest of the people that need to be at the table?
Is there any engagement with community-based organizations like sororities, temples, Eastern Stars? There are so many African-American women organizations work separately, but may not be aware of the crisis that we describe here.
We do. We are working with all of those groups. We also have outreach. We go and set up tables right in the African-American community. I have somebody that's out at the beauty salons, barber shops, tattoo parlors on a weekly basis. Yeah, we're doing that work. I know that the mobile family health unit Bond does have one. I do agree with doing a specialized unit. Martin County Healthy Start is getting ready to launch what they're calling Maternity on the Move, mom mobile unit, to provide, yeah, it's kind of cute, to bring the critical services directly into the neighborhoods. So it is that specialized care. I would love to explore that as an opportunity for our families, especially with transportation being a barrier.
Of the human resources to staff a mobile unit.
You would have to identify medical professionals, and I would rally my partnerships with Bond and neighborhood to see if they could help service them.
When actually Early Homes, his congregation bought a mobile unit. They have it. I'm not sure. I think it's probably it may be an underutilized resource.
Okay.
That we could perhaps tag into as well.
And yeah, that would be great. And I spoke with Brandy Knight at Leon County Health Department. She is looking to potentially identify or purchase some vans so that she can help transport pregnant women to their appointments. Speaking of diabetes and hypertension, there is a program down in Palm Beach called Moms with Monitors. I'm working with Brandy to bring that here and hopefully launching that late summer, early fall as well. So there are initiatives and things that are in the works to help our moms. But that transportation issue is number one, and trying to identify how to fix our transportation system, because even with the resources that we do have, it's broken. We hear moms that, you know, you're on Medicaid, there's free transportation, you call 48 hours in advance, which is great if you have an appointment, but if you have an emergency care, that doesn't work, right? Or an emergency need. But quite often their ride is canceled day of. Okay, so now they can't get to their appointment. It's happening. It's happening. Unfortunately, it's problematic. Or, you know, mom is not on a bus line and she can't utilize Star Metro, or she can't afford to pay for the bus. You know, so those are all things that as a community, it's not just maternal child health. It's everybody. So we need to pull together not only maternal child health, elder care, et cetera, everybody. And we as a community need to address that, because we're not going to move the needle ourselves.
Thank you. Thank you so much.
We do have one staff inquiry if you don't mind.
Mr. Chair. I just wanted to provide a little bit of context, because some of the initiatives that Chris spoke about when we first did the needs assessment and then had all that provider input, a lot of those ideas and initiatives, not just from Healthy Start's perspective, although Chris did participate in multiple of our needs assessment provider sessions, as did representatives from Bond, from Neighborhood, that came up why the three suggestions were what they were. Since the time that staff put together from the needs assessment, these recommendations, Healthy Start wasn't waiting, basically, and started implementing a lot of these things. So you talk about the triage piece that that you're implementing, the Connect program, which is a huge win. Those were things that we talked about last year, but in terms of timing. So while you see in the framework that was put together in direct reflection from the needs assessment that was completed last June, work, to Mimi's point, has continued, and the community is rising up and responding to the need and finding the funding to implement some of the elements to those programs. But Mom, for example, was the inspiration for the mobile health unit, specifically from Martin County, that came up to the forefront from the needs assessment and our partners at QQ Research. So I just wanted to kind of point that out, that I don't want to say time is of the essence, because I think all of the issues that we feel it's always important right now. And I think that as we're kind of moving forward and kind of thinking through it and being mindful of where do we want to focus on, sometimes it feels like there's so much that we could focus on, but I know that our community partners they're not waiting for us. And so as we continue to move forward, asking where are the immediate gaps that we can help fill, or let the existing program and infrastructure fill the immediate gaps that they can, and then help us to think innovatively about how we can really sustain this change. And I just wanted to provide that context, because so much of what you've shared was part of our needs assessment. Thank you for allowing me just that.
Thank you. Yes, ma'am.
Greetings, everyone. I know that you all might not know who I am, but my name is Trisha Young. I'm affectionately known in our community as Mama Yada. And I am the founder of an organization called Melanin Mothers Meet. Melanin Mothers Meet was founded back in 2016 after I had my first child and noticed that there was not a lot of help for Black moms in this community. So I took it upon myself, instead of becoming the obstetrician that I so graciously wanted to become. I just became a community leader and decided to bring the obstetricians and the midwives and the lactation consultants to the community where it was lacking. The awareness, the access to information, as well as the tools to have successful maternal birth outcomes. So next slide, please. So our mission has been to provide practical tools and resources to support and educate African-American women and mothers on how to have healthy pregnancies, postpartum care, and successful breastfeeding experiences. Next slide. The agenda for this evening, I know it's very brief, programs and services, the needs in Leon County and the greatest barriers, how to solve the problem. I'm sorry. Just wanted to explain the picture. I know it's super graphic. The picture is of my son. I had him at home, both of my children at home, because I knew of the maternal birth outcomes here in Leon County. So I decided to have my children at home so that I wouldn't have to face those disparities. Next slide. The programs and services that we offer are a postpartum task force, breastfeeding support, maternal mental health workshops and classes. Here on the left, there was a mental health therapist there doing a workshop with moms at the Leon County Library, which is a free space where you can book a space there for free, and we do it all the time. And then here on this other corner is myself and my daughter, and I breastfed her for about 3 years. And I would have went further, but I got pregnant again, and my daughter did not like the milk that was coming after that. And so the breastfeeding support and what that looks like, just to kind of give you an overview as far as the postpartum task force, we go into these communities, we go into these homes. We're not waiting on, anything. We don't even wait on funding. But what we do is we provide food, we provide childcare. So if you have multiple children, then you need to have somebody to watch your child while you may want to bond with your infant. So we provide that, as well as conversation, because a lot of moms need that outlet and that venting space to be able to get things off their chest. And that helps with the depression, that helps with alleviating stress, that helps with alleviating a lot of the things that they just hold inside because they don't have that trust factor with a provider or with someone who doesn't look like them. And so, like Dr. Mimi was saying, that it's very vital for Black women because of the postpartum stress that has been happening, and just stress period in our community. Obviously, we are the highest impacted group when it comes to a lot of these issues. It's good to have somebody that looks like you to be able to relate. And that's just the fact. And then the breastfeeding support, we have lactation consultants. We have internationally breastfeeding lactation consultants. We have therapists on our team. We have midwives, we have doulas, we have birth advocates. We have a lot of these things. And all these things have been facilitated and provided and networked by myself. I've reached out to a lot of people. I sit on the board of Capital Area Healthy Start. Chris has been a vital part in helping me to promote and push these services out in the community. Children's Service Council has provided space for me to be able to host things like Black Maternal Health Week that our city of Tallahassee has given us a proclamation for in 2022. And then for maternal mental health workshops and classes, we do a plethora of workshops and classes. So recently we just did the Black Maternal Health Week speaker series and town hall, where we had midwives and we had doulas and we had community leaders come in and speak on the disparities of Black maternal health and what it is that we need to work on. And I just remember one stat from one of the doctors that spoke is that 80% of the, and I think Dr. Amy says this too, but 80% of the problems that we're having in maternal health can be avoided. So, that's screaming, some type of change. We have to be able to solve this problem. It is very urgent. It is an outrage, and I'm highly upset about it. So I think that this space is a place for me to be able to express that, and I'm so glad to be here. Next slide, Holly. The maternal needs in Leon County, Melanin Mothers Meet is set out to prepare African-American mothers before and during the postpartum period due to the lack of support, which causes social isolation, mental health crisis, breastfeeding struggles, and lack of nutrition being the most prominent health inequities during this period. And this graph is just, obviously the red graph is where is the black graph, and that actually means that that's the number of infant deaths in Leon County by race, 2015 through 2022, which is a extremely higher amount than any other race. So that alone just allows you to see the importance of this work. Next slide, Holly. And continued, postpartum is a time for mothers to recover physically from childbirth and transition to their new role. However, many ethno-kinship cultures, which basically is just Black cultures that have different ideologies, they have different things that they might do in home, out of home, that may look different from the next person who might, celebrate or represent some other types of culture. And they emphasize the practice of social support rituals that offer an extended postpartum recovery period, which potentially has positive effects on the physical and mental health of mothers and parents. So now here, I just wanted to expound on that just a little bit. What we also provide is we provide the safe space for moms. So for instance, if a mom is, afraid because she's pregnant with her third child and she has no idea how she's going to do, multiple children, what I do is I facilitate other moms who have multiple children, 5, 6, 7, 8 children, and we're on a Zoom call, because of COVID, but, in the past we've been in person, and we're going to get together, we're going to talk to this mom, and that's going to push her confidence, that's going to help her to succeed in this pregnancy because she's talking to people who've already done this. And it's very, very simple, very, very simple solving of this problem, you all. And I understand that we've been in this space for about 10, 20 years, and the needle has not moved, and that is actually it's moving backwards. And I think the cure to this problem is to bring in an organization like myself, which is a Black-led organization that will help to pull in other moms. Because a lot of times when I'm going into these neighborhoods, and they're not speaking up to other organizations because the trust is not there, the rapport is not there, and the stigma is, hey, this is a healthcare provider, they don't look like me, they're not really trying to help me, because that's just the statistic. Next slide. The greatest barrier that we've seen has been the lack of support. Again, postpartum support, pregnancy support, even preconception support. Modern Western maternal health care focuses on medical interventions during the prenatal and intrapartum aimed at reducing maternal and infant mortality and ensuring the immediate physical health of the mother-baby dyad. However, less attention has been given to postpartum care. The technocentric Western approach to postpartum care usually does not extend beyond the first few days after delivery. And, postpartum care is actually the most essential part of the pregnancy, because that is going to allow you to understand where that mom is going to move in her future. Is she going to be depressed for a year or 2 or 3 years? Is she going to give the right attention to that baby? And it's just, it's really sad, you all. It's really sad. The picture on the bottom is us in the Mayor Black Maternal Health Week, them providing the proclamation to us last year as a Black-led organization in Tallahassee. The supporting data from the Florida Maternal Mortality Review Committee on risk factors for pregnancy-related deaths show that 77% occurred during the postpartum period. That's a lot. 42% occurred before hospital discharge and 35% after hospital discharge. The data demonstrates the potential for Melanin Mothers Meet to fill an important gap in promoting and providing the health and well-being of African-American mothers and infants in the impacted neighborhood communities in Leon County. Very simple. Next slide, please, Holly. How to solve the problem. This is a picture of me speaking to a mom about problem solving. I love problem solving. Melanin Mothers Meet's objective for this program is to help prevent mothers from postpartum depression, anxiety, and distress. We will share tips with mothers and families on how to identify and recognize symptoms, signs, behaviors, and preventative measures. While 10 mothers will be identified for an 8-week postpartum program provided by Melanin Mothers Meet, the program will be available to all African-American moms within the impacted community. M3 will have a recruitment plan and intake interview process with potential participants for the program. This program serves as a preventative and intervention measure for premature birth, low birth weight babies, maternal and infant mortality. Next slide, please. And this is a quote that I often share and I often live by and stand by. The secret of life is to have no fear. It's the only way to function. It is a call for Black people in this country to unite, to recognize their heritage, to build a sense of community. Obviously, I am one of 3 or 4 in here. However, I understand that we are going to need to partner together with everyone to get this needle moving. And I beg of you to really consider this organization. I know it's probably new to a lot of ears in here, but we've been moving for about 7 years, without the funding, and without the support. And we've just kind of been bringing it in here and there. And those who see what we're doing and see the work that's been put in, it's really, you're just going to support it. You're going to support it because it doesn't exist anywhere else. Next slide, Holly. And this is our information, our website here, www.melaninmothersmeet.com. And then my phone number and my email. My email is actually melaninmothersmeetm3@gmail.com. Excuse that typo. So yes, that's what I have here. If you have any questions.
How many mothers have you served and what's your capacity to serve at any point in time?
So over the last 7 years, I have served over 200 moms. And the issue with where Melanin Mothers Meet is actually, the path that we're going into now, obviously is, if you don't have data, if you don't have, the administrative parts, if you don't have any of those things, you're not really taken serious. And so the help then is using that platform to say, okay, well, the retroactive collective data that you can go and get is there. And just being able to have that support and that access to people who are able to do that for us to provide the data.
How do people access your services? Just by word of mouth? Is that how they find out about it?
So usually word of mouth or website or Instagram. We're on Instagram. That's the thing nowadays. So we're on social media. We do get calls. I run into people in the grocery store and they're like, hey, you're Mama Yada, Melanin Mothers Meet. I need help. And I'm like, oh, hi. Okay. So, definitely word of mouth is probably the biggest. And then website, content creating, that's a thing these days. So just being a part of that, being a part of Capital Area Healthy Start. So, and being a part of Florida Breastfeeding Coalition as well as a board member. So just being in the spaces like this one, to know that we exist.
So do you partner with Western medicine approaches, your typical in America, the typical delivery in hospital, et cetera?
Yes, so we've partnered with Tallahassee Memorial Hospital a few times. They've partnered with me and sponsored a few of the things that we've done. The goal is not to get everyone to do a home birth like me. The goal is to build the confidence in women to make sure that they have a voice like me, that they can be confident in whatever way they want to birth. And then to make sure that their families are on board so we can pull the families in to understand all of the things that they need to help this mom push forward and succeed.
Last question. Do you ever tag into the bonds, the neighborhoods? Do you connect with them? And because of course they're managing large populations or the residency programs. We have a large population that runs through our residency program as well.
Yes, so that's why I'm here. And over the years, I've had the capacity to be able to do a lot of these things, boots on the ground, grassroots, but with myself and others. And then, you have to be able to balance and you have your own family. You have to take care of your own family. You have to take care of your own household. So now it's at a point where we need expansion. We need funding. We need to be able to train others to know how to go into these spaces, being able to put these trainings in place, coming into Bond community, coming into Griffin Heights community, coming into Providence community, and being able to see those that are trying to help and trying to make that difference and being able to train and teach them.
Thank you.
Yes, thank you.
All right, well. Director.
Yes, so first and foremost, we want to thank you all for coming. We did something very similar for high quality early learning, and while we have the needs assessment, as we all know, it's a point in time. So it's important that as we're now another year to really hear from those who are in the community doing the work. So that as we suggest programs and initiatives for the council's consideration in this framework, we are suggesting things that are timely. So thank you so much. So next step. So what we will do is take pieces of this conversation, again, look at our needs assessment, look at the strategic framework that we added in your packet and update this so that we can bring it back to you and we can make some determinations about what direction you want us to go as far as procuring programs. If you remember, for family supports, when we put together those suggestions, we gave you one-page backups so you could see the justification, you could see some of that snapshot data, you could see some of the evidence-based stuff that is already out there and what we propose and believe the outcomes will become. So we will do that as well for this framework to give you a good place from which to start.
Well, ladies, just thank you so very much. This has been an education. One of the things I think will also be critical, we create this, finalize the framework, finalize the deliverables is found in our RFPs, in the scopes of work. The comments that you've made will certainly inform that moving forward. I can imagine that many of you will also participate or provide submissions to us for consideration as a part of that, as a part of the long-term work of the committee. But I gotta tell you, this has just been rather riveting. And by my quote, a friend of mine, Terry McKee, you can't unsee what you've seen, and you can't unknow what is now known. And I think about what Holly has just described as it related to our needs assessment and how it informs us moving forward. We will, everything that you have shared will have long-lasting impact in our process. I want you to know this has been time well spent, particularly for this committee.
And if I might, just a personal point of view. This is very important for me, having been a mom who had a birth at 27 weeks gestation, our first daughter who did not survive. And I was not living in poverty. I was not hungry. I had transportation, I had all of that. So what that says to me is there were definitely other things that into that. And so this is very important for me because I know that if we can think and do differently, preconception, and Chris knows this because I worked on a work group with her, preconception, and really focus on our moms, prospective moms, and prospective dads, and the role that they play so that it's not so haphazard. So there is thought that is put into bringing life into this world, and then the support's there for afterwards. So I cannot thank you all enough, just personally. So we are real excited about moving in this direction. Thank you for allowing me.
Thanks, ma'am.
And can I share that we are working right now on developing a preconception health education plan for women and men, working with FSU, working with my team dad program coordinator. And once we have that education plan created, we're going to disseminate that into the community, train the trainer model, go into the community, starting with Brooklyn Heights as our pilot program, train the community members to disseminate that out into the community, because we know community listens to community.
Seriously, are you all involved with the College of Medicine?
Yes.
Thank you so very much. Right?
Are welcome to stay as they continue on, or you can move on where we go. They have like, I think, one more piece of business to do. But if you're welcome to stay. It shouldn't.
I will take a 3-year-old and a 7-year-old.
Thank you. Thank you all so much.
So you know what that means.
It's dinner done.
Yes.
I would
Yeah.
love to grab a group photo of you guys
Oh,
while they
yes.
do their business. Larger count.
Next on our agenda is the program procurement approval process. We brought that to the, were you in the last?
Program services.
Program services,
But
yeah,
yeah,
but not full council.
when we brought this to the full council, there was, I think we voted it was split.
Yeah, yeah.
And what it is, the reason we even started this, we wanted to have a more streamlined process. There's interest from almost split, and we will bring. After we will have approved them here, they would then go back to the board for a small consent. And for those who would want, if they wanted to pull them, they could. I don't want to die on the hill. I'm fine if it goes back.
So what you're saying is that we will. Full council approval, yes.
And we wouldn't do it on consent, we would just have it as.
The only thing is, I just want to make sure that, I would want to make sure that there's not a long delay between meetings. Typically, there's.
If we can do it at the program services meeting, and then we have about 2 weeks, really a week, because we try to do it, then we should be okay as long as we can keep it.
What we don't want to see happen is what happened earlier, although ultimately, we can't be harangued with getting down into the weeds after we've talked about these things laborious. So after we would have done that, I mean, we are far along. And we listened to a conversation like we've heard now.
For the state.
We just wanted to create a more efficient process, but what we don't want to do, but that was why we made the recommendation. But now it will come back, the full board will get to approve the RFP before it hits the streets.
And it's the scope of work. The other pieces of the RFP are gonna be the same, but those scopes of work.
The scopes of work.
And so instead of bringing it back on consent, we'll bring it back on the.
My issue is just the timing of things and making
Right.
sure that there's not big gaps in time.
Right.
Between the point of what we do and it actually then starts moving forward in this community. But if it's 2 weeks, basically, that's to build consensus.
I don't want to die on.
Yeah, it's just a couple weeks and it'll go to full council.
So is that what this reflects?
That's our recommendation with that, would be that it would go back.
So we'll change
We'll
this.
change the recommendation that we had before. We'll defer, bring it back to the full council.
Do we need to make a motion? Or is that already in here?
So we'll need, so we can entertain a motion. We'll have to take public comment. And then you guys can approve changing so that we.
I'll make the motion that we make that change to the
Statements of
To the
order.
process.
to the process.
This work will go back to the full council, and ratified following the program services committee's review.
Yes, I'll make that right as a recommendation.
Seconded. That's unanimous.
All right.
Well, no, I don't have public comment.
Oh,
Yes, we gotta do public comment
But follow the process.
There is no public comment.
Okay, now,
now.
now we can vote.
Yes,
Aye.
okay,
Two ayes have it.
that's it.
All right. Next meeting date is Thursday.
June 1st. 5 p.m.
No.
there's someone on there.
And Chair, as you do that, so if you don't mind, I'll go ahead to next agenda.
I always want to keep it to an hour, and I've yet to do it there. And I try to keep that to, I try to keep that to 15 minutes, and that was on my calendar. But I've got a speaking engagement on the 1st at 6 o'clock.
Okay, so we will figure something out. Because we wanna,
I'm open to changing the date.
okay, we wanna do that prenatal framework so it doesn't hold us up. Okay, so we'll look at a new date, Jacinta. We're gonna look at a new date because our chair is not gonna be available. And we don't know what. Okay.
They let her take.
All right, any final comments?
Yes, sir.